my name's Maddie. How are you doing? Good. So today we're going to go over the systems review of the objective examination. So this is pretty much just going to be a screening of the lower body. So first, we'd start with observation, which starts right when the patient walks into the room. You're looking for willingness to move, quality of movement, any compensations, how they're holding their injury, things like that are really important. Then I'd take her vitals. So normal blood pressure, we're looking at 120/80 in that range. Heart rate, we're looking for 60 to 100 beats per minute, and then for respiratory rate, we're looking at 12 to 18 beats breaths per minute. So then I'd look at posture. So I'll actually have you stand up, Lindsay. So we're looking at an anterior front view, lateral side view, posterior back view. So from the anterior view, do you mind if I put my hands on you? So I'm going to look at the ASIS here, pelvis, those iliac crests. The left looks a little bit higher than the right, same with that ASIS. I'm going down, looking at the patella, are those in line? Then I'm looking down to just a point bisecting the malleoli and seeing if that's in line, and if the feet go straight up, I'll have you turn to the side. So here, we're looking at ear, shoulder, greater trochanter, femoral condyle, down to the lateral malleolus. Here would be a good view to notice any anterior or posterior pelvic tilting, or any knee hyperextension. And then I'll have you turn all the way around. Perfect. So here I can come in again, find that the PSIS. Look behind at the popliteal fossa, down to the Achilles tendon there. I do notice on the right side she's a little bit more pronated, so I'm looking at how the feet are aligned. So a little more pronated on the right side there. So now I'm just going to have you do a functional demonstration test. How does this sound? Good. Well, you don't even know what it is. So basically I'm just going to have you do some movements to see how you move functionally and if we're provoking any symptoms to see what's causing our problem. Okay. So I'm going to have you start by doing a squat. Does that sound okay with you? Yeah. Good. So any pain there? Nope. I'll just have you do that a couple times for me. Great. Any pain? Nope. All right, now I'll have you just walk on your heels, so your toes are going to be off the ground. I'm going to have you walk down this way. Good. Any pain with that? Nope. Great. Good. Awesome. Great job with that. So now we're going to do some active range of motion with some overpressure. So this is a clearing test. Typically we do this above and below the injury. Today we're just observing or looking at the whole lower extremity, so I'll do all of them. So we'll start with the lumbar spine. So I'm going to have you cross your arms for me, and then think about bringing your chin to your belly button. Good, about right there. Awesome. Any pain? Nope. Good. Any pain with that? Nope. Good. Up. Now I'm going to have you lean back for me. Good. Look at the sky. Any pain here? Nope. Good. And come back up. Now I'll have you bend to the side. Good. Any pain here? Nope. Good. Any pain with that? Nope. Great. I'm going to have you lay down on your stomach if you're comfortable with that. Good. And so I'm going to have you lift your left leg for me. Bring your heel to the sky. Perfect. Any pain? Nope. Good. And I'm just going to add some blood pressure. Anything with that? Nope. Good. Now I'm going to have you flip over if that's comfortable for you. Great. Now let's go a little bit. Better for my body mechanics. Alright, so I'm going to have you bring your knee to your chest for me. Perfect. The right knee is injured, so all the tests today I'm going to be doing on the left side. So here. Now I'm going to have so I'm going to have you bring your foot towards that wall. Any pain? Nope. Any pain with that? Nope. Good. Now bring your foot towards me. Any pain there? Nope. Any pain with that? Good. Okay. Relax. I'm going to have you slide your heel towards your bottom. Good. Any pain there? Any pain with that? Awesome. Now I'll have you bring your leg out. Any pain there? Nope. Good. Any pain there? I'm going to have you bring your toes towards your face. Awesome. Any pain there? Nope. Any pain with that? Nope. Good. I'll have you pull your toes away. Any pain there? Nope. Any pain with that? Good. Now I'll have you bring the bottom of your foot towards that wall. Any pain there? Nope. Perfect. And to the side. Any pain with that? Nope. Good. Now bring the bottom of your foot that way. Any pain? Nope. Good. Great. I'll have you sit back up. We'll do some neurological testing now of the lower extremities. So we'll test dermatomes, which are a nerve input to the skin, myotomes, which are nerve input to the muscles, and then deep tendon reflexes, which are nerve input to the tendons. So as I said, we'll be doing all our tests on the, excluding the right knee. But we will be testing bilaterally. So I'll start with the myotomes. So hip flexion, perfect. Is that any pain? All right, hold here, match my resistance. Don't let me move you. Hold, 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 hold. Good, relax. Other side, can you lift that hip? Perfect. How does that feel? Good. Hold here, hold, 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 hold. Great. All right, so I'm just going to test knee extension on this side. So I'm going to have you bend your leg, knee slight bend in the knee here. I'm going to pull you out. I'm going to push you in. Don't let me, all right? Ready? So slight bend in the knee. Next, so hold there, hold, 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 hold. Good. Now I'm actually just going to do knee flexion at the same time. Okay. So you're going to bend your knee. Okay. Don't let me pull you up. Ready? Ready? Hold, 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 hold. Good. Does that feel okay? Awesome. So now I'm going to have you bring your toes up towards your face. All right. How does that feel? Okay. Ready? Hold here. Don't let me move you. Ready? Hold, 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 hold. Is that okay? Hold here. Hold here. Don't let me move you. Ready? Hold, 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 hold. Good. Does that feel okay? Perfect. Now I'm going to have you point your toes down. There. Don't let me move you. Ready? Hold, 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 hold. Okay? Good. I'm going to try this side. Hold here. Don't let me move you. Ready? Hold, 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 hold. Great. I'm going to have you lift your big toe towards your face. All right. Hold here. Don't let me move you. Anything? No. Okay. Hold here. Hold, 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 hold. Good. Any pain on this side? No. Good. Hold here. Hold, 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 hold. Good. Any pain? Great. So now I'm going to test your dermatomes, which is the nerve input to your skin. So I'll have you lower you down. I'll have you close up your eyes for this one. I'm just going to start with a reference test on your forehead so you know what to expect. Good. Did you feel that? And where did you feel that? Forehead. Perfect. I probably should have told you before then. So I'm going to start by testing T12. So I'm going to have you find your hip bones. You're actually going to do this yourself. You're going to go a little bit in and a little bit down. Good. And then, does that feel the same on both sides? And where do you feel that? In my butt. Perfect. Let's start here. Does that feel the same on both sides? Where did you feel that? Perfect. Does that feel the same on both sides? And where did you feel it? Right. Does that feel the same on both sides? Where did you feel it? Does that feel the same on both sides? And where did you feel it?
Inside my ankle.
Does that feel the same on both sides?
Yes.
Where did you feel that?
Tops of my foot.
Moving on to myotomes.
Does that feel the same on both sides? Where did you feel it?
Lateral ankle.
Does that feel the same on both sides? Okay, where
Yes.
did you feel it?
Sorry. Back of my foot.
Awesome.
Back of my ankle.
Perfect. Great. So now all that's left is we're just going to check your deep tendon reflexes. So again, I'm not going to do the right knee here. So we'll start. If you've ever been to the doctor, it's the same kind of test. So I give her about a 2+ on the left knee.
Hold.
Give her about a 2+ on the left Achilles test there. Try to give her about a 2+ on that side as well. So all myotomes, dermatomes, and reflexes are intact bilaterally. I'm going to do one more for an abnormal reflex, so I'll have you lay all the way down for me. Awesome. So this one, I'm just going to bring this object across your foot. And we had a normal reflex there as she curled her toes in. Abnormal reflex would look like extension of the toes or flaring of the toes. So really great job today, Lindsay. Do you have any questions for me? No. Awesome. Thank you.